know the path of urine through the urinary system? Anyone do it without looking? So urine, where's the first place you see urine? It's going to be in what? Bowman's space. Then where does the urine go after Bowman's space? Proximal convoluted tubule, and it curves and twists, right? And then where do you go? Descending limb of the loop of Henle, and then you go ascending limb, and then you get into the what? Distal convoluted tubule. Then you go into what? A collecting duct. Then you go into a papillary duct, and then you drip the urine out through the little, you drip it out through a renal papilla, which is like a little nipple, and what catches it? A minor calyx catches the urine. You then have minor calyces coming together to form what? Major calyces. All of the major calyces converge on the middle of the kidney and empty into what's the area called? The renal pelvis. From the renal pelvis, you then go into the what? Ureter. You go down through the ureter and you get into the what? Bladder. And then out of the bladder you go where? Into the urethra, and then you're out, in the outside world, right? If I asked you that question in women, it would be easy. If it was in men, what part of the urethra would you come to first? Prostatic, and then the intermembranous, or the intermediate, membranous or intermediate, and then what was the last one? Penile or spongy urethra. Okay, so that's pretty straightforward. The blood thing is kind of a pain in the butt, but let me go through it on the model here because it comes up later. So here's the model, and we're going to have to switch on a couple of these things. All right. So blood flow, you come in here. What is this guy?
Renal
artery. And then these first big branches you give off are the segmental arteries. Now, when they branch and they start traveling to their respective areas, they're called lobar arteries. And then, when the lobar arteries pass between the pyramids, like here or like there, their name changes. Now they're called interlobar arteries. Then when they get to, let me change to a different part. When they get to the base of a pyramid, they make a sharp right turn, and now they're called arcuate arteries. The arcuate arteries then make another sharp turn that then goes straight out, and those are called interlobular arteries. So make sure you don't get this guy confused with like this guy. All right, this is interlobar, this is interlobular. Okay? If you want to be super fancy or you just want to avoid confusion, the other name for this is, they call it cortical radiate arteries. It's just another name. You could use either name. It's fine. After you come to those interlobular arteries, then you go to the Afferent Arterioles. And I don't know if you can see it all on this one, barely. But these little branches that are coming off here, those would be some of the Afferent Arterioles. So let me go and switch to the next bigger part of this model, which is over here. And just to give you your, sorry, I'm having a hell of a time. Just to give you your bearings on this one, so this is a super duper close up basically of a pyramid. This over here would be the interlobar artery. This cutting across here would be the arcuate artery, and then these guys going up here and over here are the interlobular arteries. Then you can go in a little bit closer, and these guys coming off here would be the Efferent Arterioles. Then you get into the glomerulus, or if you want to call it the glomerular capillaries, that's fine. And then coming off on the other side, or you can see it better over here, those would be the Efferent Arterioles. And from the Efferent Arterioles, it kind of depends on what kind of a nephron you're in, but some of them are then going to branch into what are called the peritubular capillaries that look like this. Other ones are going to branch into things that look like these are the vasa recta. But then, after that point, you basically just sort of backtrack. So, for example, this vein here would be considered an interlobular vein. Then you have an arcuate vein. And then this vein here would be an interlobar vein. And then I got to switch back to my bigger side again so I can see the stuff more closely. When you're down in here, that would be like the lobar vein. and then you get into like a segmental vein, and then finally you come over here and have the renal vein that's going to connect into the inferior vena cava. Okay? So those are the blood vessels. I could ask you, I could show you them, I could point and say, what is this? Or I could do something like where I name one of these things and say what would be expected to come right after it, or what would be expected to come right before it. So I could ask that kind of a question too. So make sure you're comfortable with that. One other thing to show you on, well, you know what? I think I'll come to that in a second. I'll wait for that. Okay, so that was that. On the models, make sure you can identify the kidneys, the ureters, and the bladder. I don't know. You know where they are. But anyway, in back, you're going to be the kidneys. I don't want to eviscerate this poor guy. I don't think we'll forever get back. And then you got the ureters, and then you got the bladder down below. I don't think that's going to give you any problems. Let me go over the bladder model.